every 66 seconds. Another senior in this country is told they have dementia. By the time this video ends, 20 more families will have heard those words. And for some of them, the cause was never just age. It was a bottle sitting on the bathroom shelf, something they were promised was safe. I'm Dr. Olivia, and after years of working with older adults and their families, I've watched this same story unfold again and again. Someone is sharp their whole life, then slowly starts losing the thread. Names, appointments, the drive home they've made 1,000 times. And everyone around them shrugs and says, well, that's getting older. Sometimes it isn't. Sometimes it's medication. Medication almost nobody thinks to question because a doctor prescribed it and a pharmacy filled it. Here's what the newer research keeps pointing to. One everyday class of drugs can pull memory and learning down hard within a single year, and most people taking it have no idea it's happening. Today, I'm walking you through 9 medications, most closely tied to rapid memory loss, counting down from the ones that get quietly overlooked to the one I consider the most destructive overall. And I need you to pay special attention to number 3. Because it's handed to millions of seniors for something that sounds completely harmless, and it may be shrinking the memory centers of the brain right now without a single obvious warning sign. Before we start, tell me in the comments how old you are and which medications you take every day. I read them, and the age of this audience shapes what I cover next. Let's start at number 9. And don't let the low spot on the list fool you, because this one is sitting in almost every medicine cabinet in America. Number 9 is diphenhydramine. Most people know it as Benadryl. It's the little pink pill people reach for to fall asleep, to calm an allergy flare, or to take the edge off a cold. It costs a few dollars. It sits on an open shelf. And most people assume that because nobody needs a prescription, it must be gentle. Inside your brain, it's doing something very different. Benadryl belongs to a group of drugs called anticholinergics. That's a long word for a simple idea. They block a brain chemical called acetylcholine. Acetylcholine is one of the key messengers your brain uses to stay alert and lay down new memories. And as we age, the brain naturally makes less of it, so it relies more heavily on every bit it has left. That means a drug that blocks acetylcholine lands much harder on a 70-year-old brain than a 30-year-old brain. One of the areas that takes the hit is the hippocampus, that small seahorse-shaped structure where new memories are formed before they get filed away. I've watched patients take a nightly simple antihistamine for years and slowly lose their edge, never once connecting the brain fog to the pink pill sitting by the bed. The research connects it plainly. A 2023 paper in the Journal of Geriatric Cognitive Health followed older adults who used anticholinergic drugs regularly and found a 54% higher risk of developing dementia compared with people who stayed off them. More than half again the normal risk from something many people treat like candy. Here's what to do. Read the label on anything you take to sleep and anything marked PM, nighttime, or allergy relief, because these are very often just diphenhydramine wearing a different name. If you take it for allergies, there are newer antihistamines like loratadine, Claritin, that don't cross into the brain the way Benadryl does and are generally safer for the long haul. Never stop a medication on your own. Bring it to your doctor. But stop assuming that over-the-counter means safe for your memory. That is number 9. Number 8 is one your stomach may love and your brain quietly pays for. Number 8 is proton pump inhibitors. The big names are omeprazole, Prilosec, and esomeprazole, Nexium. These drugs shut down acid production in the stomach. They're handed out for heartburn, reflux, and that burning feeling after meals. People stay on them for years, sometimes decades, because the moment they stop, the symptoms roar back, so it feels like the medication is the only thing holding the line. Here is the part almost nobody hears at the pharmacy counter. Your stomach needs acid to pull certain nutrients out of your food. and one of the most important is vitamin B12, critical for protecting the wiring of your nerves and your brain. Turn stomach acid down far enough, long enough, and B12 can quietly drop. Magnesium and calcium can also be affected, two minerals your brain cells depend on to fire and signal cleanly. When neurons don't get what they need, you can see misfires, confusion, slowed thinking, memory slips that look exactly like early Alzheimer's, when the real cause is a nutrient issue that was set in motion by a medication. In 2016, a large study in JAMA Neurology examined more than 73,000 people aged 75 and older. Regular PPI users had a 44% higher risk of dementia than people who did not take them. And the concern doesn't stop at nutrients. PPIs have also been linked in research to higher levels of amyloid beta in the brain, the sticky protein associated with Alzheimer's disease. So here's the move. If you take a PPI every single day, that is a conversation to have with your doctor. Many people can taper down onto a gentler class called H2 blockers like famotidine, Pepcid, which is less likely to affect thinking. Some people also find relief using lifestyle changes and non-drug supports. Deglycyrrhizinated licorice, DGL, for example, is a compound that can help soothe the stomach lining for some individuals. The goal is the lowest effective dose for the shortest necessary time, not a pill taken forever out of habit. Number 7 is prescribed for a problem many people feel embarrassed to talk about, but it affects quality of life in a very real way. Number 7 is bladder medications, especially oxybutynin, ditropin. It's given to seniors dealing with overactive bladder and urgency, the kind that can reshape a whole day. The relief is real, and the dignity it can restore is real too. But oxybutynin works by blocking acetylcholine, the same memory chemical Benadryl blocks. And this one crosses into the brain very easily and settles right where memories are made. That makes it one of the more concerning medications on this list for older adults, especially when taken month after month, year after year. In 2019, the British Medical Journal published a study of people over 65 who took strong anticholinergic drugs like oxybutynin for more than a year. Their risk of dementia was 49% higher. And here's what troubles me most. Almost none of them were warned. They were told a pill would calm the bladder. Nobody mentioned it might dim the mind at the same time. The fog gets blamed on age. People describe forgetting appointments, losing keys repeatedly, dropping the thread mid-sentence, and everyone nods and says, "Well, you're getting older." Meanwhile, the prescription is sitting right there, quietly contributing. If you take oxybutynin and you've noticed your memory slipping, take that seriously, because you do not have to choose between bladder control and brain health. Newer medications like mirabegron, Myrbetriq work through a different pathway and don't block acetylcholine the same way. For many older adults, they provide control with far less cognitive risk. Bring it up at your next visit. Number 6 surprises people because it's one of the most prescribed drug categories on Earth. Number 6 is statins. Medications like simvastatin, Zocor, and atorvastatin, Lipitor. They can play a very important role in lowering cholesterol and reducing risk of heart attacks and strokes. Statins absolutely belong in many people's treatment plans, and this is not a blanket attack on them. But there is a part of the story that often gets skipped. Cholesterol isn't just a heart number. Your brain is close to 60% fat, and it uses cholesterol as a building block for myelin, the insulation around nerves that helps signals travel fast and clean. Lower cholesterol aggressively enough, especially with certain statins that cross into brain tissue more readily, and some people notice cognitive changes. That doesn't happen to everyone, and not every statin behaves the same way in the brain. In 2023, a study in Frontiers in Aging Neuroscience reported that adults over 70 on statins for more than 3 years had a 26% higher rate of mild cognitive impairment, with higher doses linked to steeper decline. Some patients describe frightening blanks, names that vanish, a conversation that disappears, a route they've driven for decades suddenly feeling unfamiliar. Here's the key. Not all statins have the same brain penetration. Pravastatin and rosuvastatin tend to cross into the brain less readily and are often considered better options for people concerned about cognition. If you've been on a statin for years and notice fog, forgetfulness, or confusion creeping in, that's a real conversation to have with your doctor about dose adjustment or switching, not a reason to stop a medication on your own that may be protecting your heart. Quick pause. If this is helping connect the dots for you, take 1 second and tap the like button. It helps this information reach more seniors and families who need it. And while you're down there, tell me how many prescriptions you're taking right now. I read every comment. Now back to the countdown. Number 5 is benzodiazepines. Lorazepam, Ativan, diazepam, Valium, alprazolam, Xanax. These are among the most commonly prescribed medications for anxiety and sleep problems. They work by boosting GABA, your brain's natural calming signal that turns down an overactive nervous system. At first, they can feel like a rescue. Panic eases, racing thoughts slow, sleep finally comes, but over time, the picture can change. A 2022 study published in the British Medical Journal followed more than 8,000 seniors for 6 years and found that those who used benzodiazepines longer than 3 months had a 51% higher risk of developing Alzheimer's disease. Longer-acting medications, such as diazepam, can be especially problematic because they remain in the body longer and can accumulate in fatty tissues, including the brain. These medications can create a slow chemical sedation of the brain. Learning becomes slower. Mental flexibility drops. Many people describe emotional flattening, like they're moving through the world behind a sheet of glass. And the cruelest part is the exit. If a benzodiazepine is stopped abruptly, anxiety and insomnia can rebound intensely, and withdrawal can become dangerous, even life-threatening. So this rule matters. If you've been taking a benzodiazepine for more than a few weeks, do not stop suddenly. Work closely with your doctor to taper gradually over weeks or months. There are gentler alternatives for many people. Buspirone can help anxiety without the same sedation. Certain antidepressants may be appropriate depending on the person. And there are evidence-based talk therapies designed for insomnia and anxiety that can be remarkably effective without the cognitive cost. Number 4 is a single medication prescribed for 3 different problems, and it carries one of the heaviest hidden burdens on this list. Number 4 is amitriptyline Elavil. It's an older antidepressant that's still widely prescribed for nerve pain, sleep issues, and migraine prevention. That versatility is exactly why it became so common. It looks like a medication that can do everything, but underneath, it is one of the most powerful anticholinergic drugs still in widespread use, meaning it strongly blocks acetylcholine, the chemical your neurons rely on to communicate and store new memories. With long-term use, memory problems stop being a rare side effect and start looking like a predictable outcome. In 2015, a large study in JAMA Internal Medicine followed more than 3,400 adults aged 65 and older. Those with the highest cumulative exposure to anticholinergic medications like amitriptyline over a 10-year period had a 54% greater risk of dementia. And almost none of them were told. People are given it for sleep or pain and then gradually notice words disappearing, memory thinning, concentration weakening, and they assume it's aging. It doesn't even require a high dose. A small nightly dose taken for years can quietly erode cognitive function without obvious alarm bells until the loss becomes significant. If you or someone you love takes amitriptyline, that's a conversation worth having soon. For nerve pain, options like duloxetine or gabapentin may help with less anticholinergic burden. For sleep, melatonin may be appropriate for some people, or very low-dose doxepin, often considered gentler on this pathway. For mood disorders, SSRIs like sertraline or escitalopram are commonly used and generally considered safer for long-term brain health in older adults. Number 3 is the one I told you to watch for because it is prescribed to millions for something that sounds completely harmless. Number 3 is paroxetine Paxil. It's one of the most widely prescribed SSRIs used for depression and anxiety. On the surface, it seems modern and gentle, far kinder than older psychiatric medications. But here's what rarely gets discussed. Paroxetine is the SSRI with strong anticholinergic activity. That single characteristic sets it apart from medications like sertraline and escitalopram because it disrupts the same acetylcholine system that's been at the center of this entire countdown. In 2021, a review in Frontiers in Psychiatry looked at older adults taking different SSRIs and found that paroxetine users showed measurable declines in short-term memory, word recall, and attention within the first 12 months. Seniors taking paroxetine were about 30% more likely to show early signs of cognitive impairment than those using other antidepressants. There's a painful irony there. It's prescribed to stabilize the mind, yet over time it may erode clarity in the very people we most want to protect. The solution is often straightforward. In older adults, paroxetine is frequently worth avoiding when alternatives exist. The American Geriatric Society includes it on the Beers criteria list of potentially inappropriate medications for seniors, largely for these cognitive reasons. If you take paroxetine, talk to your doctor about switching to a safer SSRI such as sertraline or escitalopram, depending on your medical history. And because nutrient depletion and medication interactions can stack, it can also be worth checking B vitamin status, especially B12, when memory concerns show up. Number 2 is prescribed so quietly that many people don't even realize what category it belongs to. Number 2 is antipsychotic medications. And this one concerns me deeply because many seniors taking these drugs never knowingly agreed to take an antipsychotic. Examples include quetiapine, Seroquel, risperidone, Risperdal, and olanzapine, Zyprexa. These medications were developed for serious psychiatric conditions like schizophrenia and bipolar disorder. Today, they are sometimes used off-label in older adults for sleep, restlessness, or agitation, especially in dementia care. And I want to say this carefully. Sometimes there are situations where clinicians feel they have no other safe option in the moment, but these medications are powerful, and the risks are real. In 2022, a study in Lancet Healthy Longevity followed more than 25,000 older adults and found that those given antipsychotic medications for behavioral symptoms were 71% more likely to experience worsening cognitive decline within a year, even when they had no history of dementia before treatment. These medications can also raise the risk of stroke, sudden cardiac death, and profound sedation, which contributes to falls and hospitalizations. They work largely by suppressing dopamine, a chemical involved not only in mood, but also in focus, planning, and motivation. Reduce dopamine enough, and the brain becomes slower, less responsive. Families sometimes describe their loved one becoming emotionally flat or not there, and they grieve the gradual disappearance of a person who is still physically present. If you or someone you love is taking one of these medications, ask the prescriber directly. Why was this started? What is the plan? And is